My name's Esther Chu. I'm an emergency medicine doctor in Portland, Oregon.
I'm Margot Snyder.
Dr. Robert Morin.
If you're sick with COVID virus needing hospitalization, most likely I'll be the one who will be taking care of you.
These are simply not normal times.
I'm Dr. Adam Friedlander. I'm the Director of Pediatric Emergency Medicine at Northside Hospital in Atlanta. We're all talking about buying the right mask on eBay. We're going online and trying to see who might still have something in stock. I spent roughly 10 times retail for 2 masks that I hope aren't expired. The CDC came out with a recommendation that when these supplies run out, we may want to use a bandana tied around our face. The fact that a recommendation like that came out from the Center for Disease Control is mind-boggling to me. What do we do when half of your doctors are out on quarantine? You have no more beds, all your ventilators are used up, and there are 1,000 new diagnoses in a single day. What do you do then? That's what we're bracing for.
We do not have enough to last us for what's coming. I'm a practicing emergency room doctor and the leader of one of our groups here in the Central Coast of California. We know that we don't have enough N95 masks. We know that we don't have enough what are called PAPRs, the special type of hood that people use when they intubate or place a patient on a ventilator. We're trying desperately to get our hands on these. The hospitals are ordering them and they're not showing up. We're seeing healthcare workers get sick at a much higher rate than the general population. These are young, healthy, go to work every day physicians and doctors. Without the protection, you're going to lose us. You're going to lose physicians and you're going to lose nurses. And if you lose them in a small community like we are in, then you don't have a backup for that.
I've never used any of these items for more than a single patient because of the risk of transmission. We generally take them off right after a patient and put them right into the garbage can. I mean, we're really going into crisis mode.
We're getting no support. That's the bottom line. We're getting no support. And in fact, we're getting the opposite of support. We have to fight with a shortage of protective equipment. We have to fight with hospital administrators who are threatening to discipline us if we protect ourselves. A patient comes into the emergency room for something completely unrelated. They're cared for by, 20, 30 different healthcare providers. And then a day or 5 days later, we find out, that patient was infected.
We are at higher risk than general population to catch the infection and to perish from this infection. I'm working on my living will, and the same concern has been raised by other healthcare providers. And that may sound gloomy to most. It is gloomy, but it is a fact, and we should be prepared for that. Yeah, very scary.
We're stepping up and we're battling this virus, but we need support.
We need this equipment to keep us safe.
The greatest risk that we face right now is overwhelming our healthcare resources. And that's not just filling up beds and using up all of our ventilators. It's knocking out our workforce if they become ill.
We're going to come every day to work. We're going to put our lives on the line. We're going to do everything we can to save your life. And so we need your help to make that possible.
Things are really dire in certain parts of the country. One pregnant nurse told us that while she has no N95 mask, she's been told she must report to work. She didn't want her name used for fear she'd be fired. Help is on the way. We just have to hope it's going to get there soon enough before it's too late.